My baby is 4 weeks old and hasn't pooped. He's breastfed and he just has not pooped. As a pediatric RN, I get this question asked multiple times a week, and here's how I triage those phone calls. It's actually super common and normal for your 3 to 6 week old baby to slow down on the amount of stools they have either throughout the day or throughout the week. Initially, it feels like you're changing their poopy diapers 6 to 8 times a day, and then it starts to slow down once your milk comes in. It can even be alarming if all of a sudden you go by a whole day or maybe even 2 days and then your baby hasn't pooped at all. And it can kind of be a little worrisome because they were pooping so frequently and then all of a sudden they're not. And that's when I get those phone calls around 3 to 6 week mark where babies are just not pooping and parents think that their baby is suddenly constipated. So just know it's pretty common, and these are a couple things you can look out for to make sure it's not something that you have to head to the ER or call your provider about. Your breastfed baby before 6 months should always have soft stools. So if suddenly there's hard, lumpy stools, that's a concern. And you also want to pick up the phone if there's uncontrolled vomiting along with the constipation, if there's less than 4 to 6 wet diapers throughout the day, and for whatever reason, baby seems inconsolable. You cannot calm baby down no matter what you do. Baby could be in pain. You also want to see baby if they're not feeding well for whatever reason, 2 feeds go by and they're really not suckling well, or they're being super lethargic where you go to change their diaper, they're not moving much, their little arms are not moving and reacting, their muscle tone is a little weak. We want to definitely see them for that. We also want to see them if there's blood in the stool, blood in their vomit, and also if for whatever reason they have a history of holding on to that dark meconium, that poop that came out of them right after delivery. If they have delayed meconium where it lasted for more than 2 to 3 days, we want to phone call the provider and just make sure everything's okay. So these are some triage items, but follow for part 2 on how you can actually help your baby poop. There's some things you can do about that, so follow for more.